Now that Canada has approved a third vaccine in its fight against COVID-19, provinces across the country, including Ontario, are gearing up to vaccinate millions of people in the months to come. But with potentially more vaccines hitting the market here, experts are reminding Canadians not to compare them head to head right now.
I understand people's trepidation about, why am I getting the lesser quality vaccine? But it's not clear that it is a lesser quality vaccine, first of all. And second of all, let's get some immunity into us.
The efficacy rates for the approved vaccines vary. Pfizer and Moderna have both reported their products to be 95% effective in preventing COVID-19 infections, while clinical trials have found the AstraZeneca vaccine to have less efficacy, believed to be around 62%.
Let's not hang our hats entirely on the clinical trial data. The fact is, we have vaccines. This is a miracle.
Epidemiologist Raywat Deonandan says it's important not to compare the vaccines head to head, noting some factors to consider during clinical trials. There were different populations completed at different times, and in some cases, there was exposure to new variants. In others, there wasn't.
All of these vaccines, they're 100% good at preventing serious cases. So if your goal here is to avoid having scarred lungs and long-term disability and hospitalization and death, all the vaccines that Health Canada has authorized get that job done.
Something Health Canada is considering, that the virus does mutate. Research is underway as the situation evolves.
One strategy against the variants is that you have a booster. Another strategy is that you have potentially a redesigned or an updated vaccine. People are also talking about mixed schedules. So you have one type of vaccine for one dose, potentially another type of vaccine for another dose.
So what does this mean for people looking to make a decision about which vaccine to get?
First of all, there may not be a decision to be made where you're offered what you're offered. And frankly, my position is you take what you're offered because it may be a very long time before something else is offered to you.
Some countries are using the less efficacious vaccines on the lower risk populations, mostly young people who are less likely to be hospitalized and die.
The UK uses the AstraZeneca dose liberally, largely because they developed it, and their cases are dropping tremendously quickly. So it's working well there, and they're going to reach population immunity before us, probably.
The Johnson & Johnson vaccine could get Health Canada approval within the next couple of weeks. That efficacy rate is set to be about 66%. For a full interview with Dr. Sharma, you can head to our website, citynews.ca. In Toronto, I'm Faiza Amin for City News.